There's so much great awareness on what to do for patients with lymphedema and for those patients who are at risk of lymphedema nowadays, that it's important to know that there are also things that are really bad to do when you have lymphedema or when you are at risk of lymphedema. Here are my list of the top 5 things you want to avoid. The number one thing is taking the wait and see approach. If you have lymphedema or if you are at risk of lymphedema and you start noticing subtle changes, the arm or the leg or the area affected just starts to feel different, or perhaps there's a little numbness or tingling or just a vague sensation of pain or heaviness in the limb, you really need to get in to see a certified lymphedema therapist as soon as possible. Research proves that the earlier we start treating a lymphedema, the better results we'll have and potentially prevent it from getting worse. So if you know you have a history of lymphedema or you know you are at risk, as soon as you start to notice anything, make sure you get in to see your therapist. The number 2 worst thing that you can do if you have lymphedema or if you are at risk is to avoid taking care of your skin. Our skin is our body's largest organ and needs to be treated with love and care. Making sure that you keep your skin moisturized, you prevent cracks and little breaks in the skin that can be sites for bacteria to get in and cause infections. If you're going to be spending time outside, making sure that you're wearing sunscreen or bug repellent, because bad sunburns and bad bug bites are inflammatory responses, and I've personally seen excessive sunburns and excessive amount of bug bites exacerbate and cause a lymphedema. The final thing when it comes to skincare is knowing the signs of infection. Anything that is red, swollen, painful, irritated, hot to the touch, causes an internal fever is a sign of an infection. You need to call your doctor immediately and get a prescription for an antibiotic in order to properly treat an infection. The number 3 worst thing you can do is to stop moving entirely or to overdo it on the exercise spectrum. Lymph fluid loves to flow, and movement is the best way to accomplish that. So you want to make sure that you are moving your body appropriately. I have lots of great videos on how to move and how to improve lymphatic flow. But on the flip side, if you've been working out at a higher level and you take an exercise vacation or you fall off the wagon for a while, getting back on the wagon is important. But if you go back and start at the high level that you were working out before, you have a higher chance of muscle injury and potentially exacerbating your lymphedema. So understanding the balance between not moving enough and moving too much is going to be really important. The 4th worst thing you can do is forget to drink water. Dehydration is known to make lymphedema worse, and it's really important to make sure that you're drinking enough water throughout the day. The last thing you can do that's absolutely terrible for managing your lymphedema is stop wearing your compression. Now, I see this a lot. My patients do so well, everything is under control. They ask me if they can stop wearing their compression sleeve. And the true answer is probably not. If you stop wearing your compression on a regular basis with a known lymphedema, the chances of it creeping back up and getting worse again are high. So this is my list of the absolute worst 5 things you can do if you have lymphedema or if you are at risk of lymphedema. I hope this has been helpful. My name is Lisa Berman Sylvestri. I'm a physical therapist and a certified lymphedema therapist, and my goal is to make us all lymph smart.